Welcome to The Explainer. Today, we are going to completely flip the script on something you probably have sitting right now in your medicine cabinet, or maybe on your nightstand. If you think you already know everything there is to know about melatonin, well, get ready to be amazed. We're unpacking a really revolutionary concept in immunology called the immunopineal axis. And I promise you, by the end of this, it's going to completely change how you view this super common yet deeply misunderstood hormone.
Okay, let's dive into this. Is melatonin just a simple sleep aid? You know, for decades, both the general public and honestly, even the medical community have kind of treated this hormone like a basic biological lullaby, right? Like it's just something you pop before a long flight to beat jet lag. But modern immunology has completely shattered that myth. Endogenous melatonin, meaning the melatonin your own body naturally produces, is actually this microscopic hero. It acts as a master immune commander, working tirelessly behind the scenes to keep your immune system regulated and essentially prevent it from going rogue. So, here is our roadmap for today. We'll start with why melatonin is way more than just a sleep hormone, then we'll dive right into the pathophysiological mechanisms and uncover a really fascinating clinical paradox. After that, we'll cover its role in rehab and bone protection and wrap the whole thing up with some key takeaways you can actually use in clinical practice.
All right, Section 1, more than a sleep hormone.
So, modern immunology has totally shifted its paradigm when it comes to the pineal gland. You know, that tiny little structure in your brain that produces melatonin? We now know it's not just a sleep center. Instead, it actually commands a cutting-edge protective system known as the immunopineal axis. Think about what happens in autoimmune diseases. Your immune system basically gets confused and starts attacking your own tissues. Well, endogenous melatonin acts as a natural buffer right at the control panel of this axis. It commands the immune troops to stand down, which softens that devastating autoaggression.
Moving right along to Section 2, pathophysiological mechanisms.
At the absolute root of autoimmune diseases is a fundamental imbalance in your T lymphocytes. Basically, your immune cells are miscommunicating. Now, what's really interesting about this is how melatonin's rescue mission actually fixes that imbalance. Step 1. Melatonin directly suppresses aggressive Th1 and Th17 cells. Think of these specific cells as the aggressive attackers. They're the ones producing the inflammatory cytokines that actively destroy healthy tissue. Melatonin aggressively dials them down. Step 2. It stimulates your regulatory T cells, or TRED cells. These are basically the immune system's brakes. So by boosting TRED cells, melatonin is literally giving your body the stop command. And finally, Step 3. It acts as a remarkably potent antioxidant. By blocking oxidative stress and shutting down the NF-kappa B pathway, melatonin essentially saves your fragile nerve and blood vessel cells from cellular death.
Understanding these mechanisms really explains exactly why your daily habits are so absolutely crucial in preventing autoimmune diseases from triggering, especially if you already have a genetic predisposition. Take circadian asynchronization, for example. Working night shifts or staring at blue light from your phone late at night literally cuts off your natural melatonin peak, and that leaves your immunity completely unchecked. But the good news is, you can build what we call an epigenetic shield. Getting to sleep by 10:30 p.m. creates this vital dark window where those calming TREG cells can properly audit your immune system. Oh, and we definitely can't forget the gut microbiome. Did you know a massive amount of melatonin is actually produced right in your intestines? Yeah. It's made in the argintivin cells to strengthen the gut barrier, which blocks toxins from entering the bloodstream and helps prevent leaky gut syndrome.
Which brings us to Section 3, clinical paradox and diseases. And this brilliantly illustrates that as powerful as endogenous melatonin is, it is definitely not a one-size-fits-all magic bullet. The specific pathogenesis of a disease really truly matters here. For instance, in multiple sclerosis, it's a strong protector. It heavily blocks those destructive Th17 cells that attack the myelin sheath. Fun fact, this is actually why MS flare-ups statistically drop in the winter when our natural melatonin synthesis is higher because of the longer nights. For systemic lupus, it acts as a positive modulator, shielding the kidneys and blood vessels from huge amounts of oxidative damage. In psoriasis and IBD, it acts as a therapeutic helper, aiding microcirculation and mucosal healing. But then, look at rheumatoid arthritis. Here, we see a totally paradoxical dual effect. Let's actually pause and expand on that, because this is a massive, totally counterintuitive twist. We call it the rheumatoid arthritis paradox. While melatonin generally lowers systemic inflammation across your whole body, inside the synovial joints, it can actually stimulate inflammatory macrophages. Because your natural melatonin peaks between 4 and 6 a.m., well, this is the exact physiological reason why RA patients wake up experiencing that agonizing morning joint stiffness and pain. It's wild, right?
So this is a crucial warning for clinical practice. Giving artificial melatonin supplements to an RA patient can actually be dangerous and trigger pain. That being said, maintaining their natural circadian rhythm still remains absolutely vital for their broader health.
All right, Section 4, Rehab and Bone Protection.
So when patients are battling severe autoimmune diseases, they often have to rely on heavy-duty immunosuppressants, things like glucocorticoids and cytostatics. And look, while these drugs are absolutely life-saving, their side effects can be brutal. This is exactly where endogenous melatonin steps in as an indispensable holistic shield. First, it mitigates side effects. It literally shields your cellular mitochondria from the intense oxidative stress and even the cataracts that are so often caused by heavy steroid use. Second, it has an incredible osteoprotective effect. Hormone therapies are notorious for breaking down bone and causing fractures, but melatonin fights back. It boosts the osteoblasts that build bone and hits the brakes on the osteoclasts that destroy it, actively preventing steroid-induced osteoporosis. Finally, let's be real, autoimmune diseases carry a heavy mental toll. Melatonin aids in neuropsychological rehab by increasing neuroplasticity. This actively combats the depression and chronic fatigue associated with these diseases, dramatically improving the patient's overall quality of life.
And finally, Section 5, Key Takeaways and Clinical Practice.
So, the crucial point is, how do we take all of this intricate textbook science and actually apply it in the real world to help patients maintain remission? Well, it builds into a highly practical 24-hour lifestyle prescription that every doctor needs to be discussing with their patients. On the daytime side of the protocol, you really need to walk in bright, natural sunlight. This brilliant natural light stimulation actually preps your pineal gland for a robust, healthy synthesis of melatonin later that evening. And on the nighttime side, light hygiene is completely non-negotiable, especially if you have an autoimmune condition. You've got to strictly ban blue light screens, no smartphones in bed, no laptops late at night. Or, at the absolute very least, use high-quality blocker glasses for a full 2 hours before sleep.
Look, there is a core concept here that I really want to hammer home, because it represents the entire future of holistic immunology. You cannot achieve stable remission with immunosuppressants alone without restoring the patient's circadian rhythm. That is the ultimate takeaway of our entire explainer today. You can prescribe all the heavy-duty pills and cutting-edge biological drugs in the world, but if the patient's internal biological environment is fundamentally broken, if their immunopineal axis is completely out of sync because of terrible sleep and poor light hygiene, those expensive treatments are fighting an impossible uphill battle. Which leads us to a final, pretty provocative question to wrap up this explainer. As we look at the incredible, multifaceted power of endogenous melatonin, how it commands the immune system, protects our bones, and regulates our cellular health, we really have to ask ourselves, are we truly treating the disease, or are we just throwing medications at symptoms while completely ignoring the body's natural clock? It's a profound paradigm shift for sure. It forces us to look at healing not just as suppressing an illness, but as honoring and restoring the body's deeply ingrained natural rhythms. Thank you so much for joining me on this explainer. Keep learning, keep questioning, and I'll see you next time.